my name is Jeff Ray, Executive Director of Business and Technology at Omron Healthcare, and we're here at CES 2021 to show off Omron's very first introduction of a remote patient monitoring platform called VitalSight. VitalSight is a service that allows you to connect your health data from devices at home, namely a blood pressure monitor or a weight scale, and share that information directly to your physician, either through their electronic medical record system, sometimes called an EMR, or through the doctor dashboard. When the data shows up in the doctor's EMR or doctor dashboard, they're able to see your trends over time, to see what's going on, if their medication is having the directed impact on your blood pressure or not. It allows for that better patient to physician communication, and it alerts your doctor if there's something that's going on at home that is an urgent situation or requires them to take more notice of what's going on. So if there's something, reading a blood pressure reading that is outside the limits of where they want you, they would actually receive an alert telling them that your blood pressure is higher than where they wanted it. Based on that, the doctor can then proactively reach out to you and ask you if everything is okay, or ask you to come in for an appointment, even though your next appointment may not be for 3 months. So having that data gives the doctor another tool. It's information about what's going on to you when they're outside their office.
So is that like a kit? You get like the box that has all the different stuff?
Yeah,
and it's totally connected with secure, like privacy and all this stuff that might be required for this kind of stuff.
Yep. So we wanted to make this kit extremely simple, both for the physician and for the consumer. So when the kit shows up on your doorstep, everything is already paired. It knows who you are. So when you open the box, we even put the batteries in it. Everything is ready to use right when you open the box. So you open the box out, you can put the cup on, press the start button. Automatically, it sends the data to this hub. This is a cellular hub that sends the data to your physician. Even though it's cellular, there's no cost to the patient or the hospital. This is all part of the Omron kit. It sends the data securely. So right now, we look at data as being extremely important that it's secure. But the data is your data. It's the patient's data. It's not Omron's data. So whatever you want to happen with the data is what will happen. If you want to transmit it to the doctor, great. If you want it kept to yourself, that's great. But Omron doesn't do anything with the data. When we do transmit the data to your doctor, the HIPAA requirements require that data be transmitted at 128 kilobits of security. We actually go beyond that. We actually encrypt at 512 kilobits of encryption. So we wanted to make sure that we had the data as secure as possible as we're delivering it to the doctors. And we go through security audits with each hospital and each physician we work with to make sure that we're meeting all their standards for data security.
If I understand correctly, the issue here is a lot to do with private health insurance companies, right? Or what is it? Why would people want to keep this private? What is the thinking?
I'm sorry, keep their data private?
Yeah, I mean, what is a big scare? Or I mean, I just hope that this kind of technology doesn't get delayed, or what do you call it? For all these people talking about it's very important to keep privacy. It has to do, I guess, with the system of private health insurances that might not insure people that have some issues, or?
Well, I think there's a couple of different questions there. So it is important that patients understand their own health data. But to do that, we think it's important to have that dialogue, that patient to physician communication, so they can understand their health data. So we think that if you can understand your data and we're transmitting it to the doctor so you guys can have a dialogue where you're looking at the exact same information, then you guys can talk about how to better increase your treatment and understand what's going to have the biggest impact. So for example, a doctor calls you and says, I'm going to change your medication. I'm going to take you off one, put you on a new one, or I'm going to take the ones you're on and just adjust the levels. Well, a doctor normally wouldn't know the impact that would have on you to the next time you go in, and only in a snapshot at that time that you're in the office. What's great about this is any changes to the treatment, the doctor can actually look at your data and see the impact right there. I changed this medication, but it's not having the results I want, so we're going to put them on a different medication. The average patient takes about a year to figure out the right combination of all the antihypertensive drugs out there to find the one that is going to put that particular patient under control.
So there's this crazy big thing happening right now with like big issues, right? No real trade shows and everything is online. And is this very relevant for this kind of sickness, disease also? Because there's a whole part of potentially getting the treatment at home, right?
Yeah, so a lot of different, we've been working on this for 3 years. So this wasn't something that happened in response to the pandemic. We've been knowing that people need to be taking better care of their heart health at home. And that's why we actually developed this program. It's a hypertension management program. But with the pandemic going on, there are a lot of people who need to be getting treatment, going to see the doctor, concerns about their elevating blood pressure, and aren't. They're just concerned about going into the office. This is a great way for them to be able to share the information of their vitals directly to the doctor without having to go into the office. So we think this is a great way to have conversations between doctor and patient without you ever having to physically go into the office.
Because there are many different diseases that are related with the heart and blood pressure, right? It covers a lot of, many different things, right?
Yep. Yeah, so this being a hypertension management program, that is what our first and foremost priority is. However, a person is much bigger than maybe one chronic condition. We want to look at the entire person. So we can still use the VitalSight platform, even though it's designed to work with our blood pressure monitor and scale right out of the box. There is the ability to add other devices from other manufacturers, other than Omron even, onto the VitalSight program. So they all feed directly into that doctor as well, so they can view the data. Again, we're starting with the blood pressure and the scale, but we absolutely see the ability to add a lot of other condition monitoring devices to this program, whether it be diabetes, oncology, high-risk pregnancies. There's a lot of different things that we could use this platform to monitor the health status of somebody while they're at home and let the doctor have access to that information.
So do you monitor the oxygen levels in the blood? That's one of the...
That is, so temperature, oxygen levels, those are all things that we've received requests from healthcare organizations wanting to know if our platform can handle that, and it can. Again, Omron doesn't make those devices, but if a physician or a hospital comes to us and says, we think that this is important for what we're doing, can you send us that information? We absolutely can have that ride on the rails of the integration that we've built into the hospital system, so they can go into the same dashboard that they're looking at the blood pressure, and they can see temperature, blood oxygenation, and anything else that they want to
add. What is a platform that allows you to collaborate with other device potential makers? Is it just like a Bluetooth connection, and then, or is it like a specific platform there going on?
Yeah, so a lot of times it's us getting the library, making sure that the library is integrated into the data hub, so that when you bring that device into your house, that it knows how to communicate to this, and that way it sends that 512 encrypted data to our server. The server then has to take the data and translate it into something called HL7. That's one of the most commonly used languages that communicates with the hospital. And so, yes, if somebody wants to work with this, they just have to call us up and say, we want that device to work on your platform, and we can make it happen.
But you're already covering a lot with this kit. And is this something that potentially is just included with the insurance, or like, shouldn't it just be something that everybody gets that actually needs it?
We believe so. We believe because remote patient monitoring is still fairly new. We see that this is going to be expanding. We've already with the first couple hospitals that we piloted with, places like Mount Sinai, New York, and Northwestern Medicine, Chicago, and Highmark, we're seeing that if they put their patients on this program, it actually saves them money in the long run because they're not having patients go to the emergency room. They're not seeing patients that maybe the medication isn't as effective. So at the end of the day, from the hospital and the insurance companies, this is saving them money. So we want everybody to have these kits and not put that burden of all the costs on the patients themselves.
So I'm sure there's a certain cost in this kit, right? But I would guess that sometimes just one visit to the emergency room or one kind of these visits is cost more than the whole kit.
Yeah. Well, not only that, I mean, yes, you can say an emergency room visit or, any type of event is very costly. But I actually think in aggregate, it's the small savings over time that have the biggest impact. So when you look at a typical physician, anybody who calls in and says, I want an appointment, they can come in, whether they may need an appointment or not. This way, with the data that's coming into the doctor, the doctor can actually look at all their patients, all the data out there and say, no, Mr. Smith hasn't called us, but I can see his numbers don't look right. I'm going to prioritize him to come in, and somebody whose numbers look good, they don't need to be in this week. They can come in 2 weeks from now. So it's seeing the right patient at the right time that over time will save the most money.
And I see you wearing the HeartGuide. So how's it going with the HeartGuide? I'm getting lots of comments all the time, people asking, and I think they're asking also where to buy it sometimes because they can't really get it everywhere. I mean, there's 200 countries that don't have it yet, but you do have some countries that have it, right?
Yeah, we do. So the U.S. was our first launching point, and that's where we're having phenomenal success. Matter of fact, we're trying to keep up with all the demand of the orders actually coming in. But every country has their own version of the FDA, people that are going to make sure that a device has the medical accuracy and meets all the claims. So we have to go through that process at every single country that we launch in. And I believe we're at somewhere between about 7 and 10 different countries. So places like the UK, Germany, Spain, France, Japan, a couple different places in Southeast Asia. So we are starting to get that out more commonly. But yeah, it's going fabulous for us right now. The one thing I do want to remind people is that if you are going to be a HeartGuide user, please understand that although it's a wearable, you still have to follow the guidelines for taking a good blood pressure, which is you still need to be at rest when you're taking your blood pressure. So you have to look at your own lifestyle and say, am I somebody who's going to be taking my blood pressure mostly in the house? Well, if so, then maybe an upper arm blood pressure is for me. If you're somebody that's going to be out and about and want this, just make sure that you're taking your blood pressure in a resting condition.
So that means you need to have it, you put it up at the height of your heart.
Yep.
And resting condition, that means not walking around?
Yeah, so we get a lot of people that will call us and say, hey, I'm on the treadmill right now, and I'm on mile 3 and I want to take my blood pressure. Can I still take it when I'm on the treadmill? And the answer is you can. You just don't have anything to compare it to. So the American Heart Association says the guidelines for normal blood pressure are below 120/80. Well, if you're on a treadmill, that's not resting. So when you're on a treadmill, it's going to elevate your heart rate. Well, it may elevate it to 145/90. Well, is that good for a working out blood pressure? We don't know. There's American Heart Association or anybody has any studies on that. So if you're going to use this device, be in a resting condition.
And it's totally integrated with the VitalSight?
It can be in the future. We want to make sure that the 2 devices that we put in there for normal and large arms, and even an extra large cuff that can go up to 20-inch arms, we wanted these to be the first ones that we put into the kit because they were going to be the simplest for us to get out into the market the quickest and integrating into those EMRs. If we get approached by a hospital system and they say, but we really want HeartGuide, we can go through that process. And
is there a price for this kit?
There's not a price to the for the patients. The only cost would be to either the hospital or the insurance company. But we work with them depending on how much savings they're seeing by having their patients on this. That's where we would talk to them about what the price would be for them.
And I'm guessing also the price depends on if they just want to give it to everybody who actually needs one, right?
Yeah.
Which maybe some countries should just come and say, hey, how do we get everybody in the whole country on this? Because in some countries, especially everywhere that's not the US, it's like the government is paying for healthcare, right? So they might be saving a lot of money on this. Yeah. And they keep people alive.
Yeah. Now, really what it's going to boil down to is I wish everybody was that taking their blood pressure knew what their numbers were. However, you're probably not going to see any cost savings, healthcare economy cost savings, if you're giving it to a lot of healthy people. They should still own a blood pressure monitor, but they probably don't have to be doing it every day, every week, every month. They probably just got to know occasionally. Really, this program is targeted more for those, at least in the US, 37 million people that have stage 2 hypertension that are not controlled. Even though they're on medication, even though the doctor has them doing lifestyle changes, they're not being controlled right now, being below 120/80. Those are the people at highest risk. Those are the people we want on this program to help that doctor have a tool to help get them under control.
That sounds like 10% of the population. That's a lot of people.
37, yeah, it actually is. I mean, there's 116 million that are hypertensive, but 37 million of them are uncontrolled stage 2. So that's the highest level, and they haven't figured out yet how to get them down to a less risky situation. So that's where we think that this program will have the biggest impact, not only on the health and outcomes of that patient, but also on the economic standpoint of where hospitals spend the majority of their money trying to bring down the health results of people that may be at highest risk.
So on your website, there's, for example, an example talking about, is it also useful for people who might be elderly a little bit, like in terms of making things simpler, or it just takes care of everything, no need to take notes, it just automatic?
Yep. They no longer have to write it down on a piece of scratch paper or a napkin that they stick in their jacket that they have to remember to bring with their doctor. Even when the kit shows up, there looks like there's a lot of technology out here, but it's really not. When this shows up, the batteries are already in it. Everything is already connected. The only thing you have to do is plug in this hub. Once you plug in this hub, it knows who you are. We've done the pairing process of saying, we know that this is John Smith, whose doctor is, XYZ. It knows who you are. So when you plug this in, every time you take a reading on the blood pressure monitor or the scale, it will send that data directly to your physician. There's nothing you have to do. You don't have to pair it with your phone. You don't have to communicate or connect it to your Wi-Fi. There's nothing you have to do other than put on the cuff, hit start, plug in the monitor. So we try to keep it as simple and as easy as possible.
And this scale that you have does ECG kind of thing? Where
I'm sorry, say that one more time.
Is it something like an ECG that takes the current through the body? There's two little, sensors there?
So this on the scale is actually a body composition monitor. It just gives you more than your weight. This will tell you what your skeletal muscle is, what your body fat content is, what your visceral fat around your primary organs are. So it gives you a little bit more information related to the composition of your body. But what you were alluding to is that Omron does have a partnership with a company called AliveCore that specializes in ECG, helping those who might be at risk of atrial fibrillation be able to know if they are experiencing an AFib issue, or in many cases, people who don't know that they have AFib, we can actually help them determine if they do have it. So with that partnership, I do see that becoming part of VitalSight in the near future. Again, this is a hypertension program first and foremost, but we will be adding on other layers in the future that will allow them to monitor even more conditions.
So available right now, and again, you have to go through all these different regulate or get it approved, or is it already all these different parts are approved and it's just a question of selling the kit and that's it?
Yep. So every product that's in here is FDA cleared. has been through there. These are the same devices you could go into a store and purchase on your own. We've assembled them into a kit to put into the VitalSight service. The service is the important part. That's the part that actually links it to your doctor. So this is available now. We've been piloting it with a couple different healthcare organizations over the past couple months. But CES 2021, we're officially going live and making it available to any physician or hospital that wants to have VitalSight as an offering for their patients.
So I guess every patient is a different requirements and stuff like that. But is there some kind of way to say that it's a good time to do it, take a measurement after eating or in the evening or the morning, or what kind of, how many times maybe will people be using this every day?
So everybody's different. I would tell you to always start with your physician, have the conversation with them, ask them how often they want you taking it and sending the data. Outside of that, the American Heart Association does have their own guidelines. You do have to be at rest. You don't want to take it after you eat. You do want to be sitting down. So I would follow all the American Heart Association guidelines and then have that conversation with your doctor and figure out what's the right schedule for you.
And just a question about the HeartGuide, because I'm getting so many hits on my video about the HeartGuide. There are some other kind of like cheap smartwatches that say they take the blood pressure measurements, but this HeartGuide device is the unique in the world. There's nothing like it that does exactly like real blood pressure measurement.
Yeah, there's a lot of new technology out there that is great technology that over time hopefully will become as accurate as oscillometric blood pressure. You still, according to the FDA, there's only one FDA cleared way to accurately take a blood pressure reading, and that's through oscillometric. That's the inflation of the cuff that's on your wrist, and so that's really the only way that's FDA cleared out. But there is promising technology. I just don't know how long it's going to take for that technology to be as reliable as the technology that doctors currently trust, which is oscillometric. And it's important that physicians and patients can trust the reading that they get, because they are going to be making decisions on treatment based on those readings, especially in a program like VitalSight. So they have to be able to trust the readings that are coming in there.
So now how long have you been working on this kind of technology, maybe at Omron? Are you, positive about this word, the future is looking bright? Like, are we going to get to zero death? And there's a lot of, is this really going to help? And do you see, is there a way to measure how many people you save? Can't you just show like the style sheet, and that would just convince everybody? I mean, immediately, right?
Yeah. Patients and consumers are interesting. You have to be able to develop a platform that they want to stay engaged with. Developing VitalSight for me, I've been working with Omron a long time. I've developed a lot of great products with the teams that we have back in our offices. Even things like HeartGuide, great technology. However, we've always looked at this as there's three components. There's the devices. The devices have to be accurate and reliable. Then there's the data that we send to the doctor. And then lastly is, how do we analyze the AI and the machine learning that goes into getting the insights from that data? So devices are great, but it's a third of the solution. VitalSight is great communicating with the data to the physician, but it's a third of the solution. The last part of it is being able to start talking about predictive analytics and how do we look at the data to understand when somebody's going to have an event before it actually happens. And that's the last third, and that's kind of the future part. So really all of these have to be working in conjunction together to really start working towards making that dent in zero events. That's our mission. That's what we've been working for 40 years, almost 50 years now. When we start working on that last part of it and it all is kind of working together, that's when we'll start achieving some of the biggest leaps in going for zero.
So I'm not a doctor, I'm just a YouTuber, but I'm also thinking there's probably also a lifestyle that needs to be connected with like the the suggestion of, or like measuring how the life, because I guess many of the patients need to change their lifestyles and you need to actually show proof that it's happening or something like that. And so that's, I guess, also a whole different area to, I don't know if you have products in that area.
Yeah,
like
you're absolutely right. When I talk about that last portion of being able to do the predictive analytics, a lot of times that goes into behavior change as well, in understanding when somebody may be on a trajectory that's not good and how we go about in changing that. And a lot of times that can happen through lifestyle, health coaching, being able to let them know what's having the biggest impact on their health. So if they can actually see their data coming into their doctor may say, listen, you're fine during the week, but the weekends, not so good. What's going on? So being able to have that conversation with a patient and understand what's going on in that person's particular life might be able to help us take the next big step towards zero events and reduction of cardiac events.
I don't know if that makes sense, but maybe there should be a partnership also with the supermarkets or the grocery delivery kind of system that customize maybe the whole package somehow. I don't know.
The health ecosystem that can come off of something like this is phenomenal, and it's really going to be what changes healthcare in the future. Is once we start having the data to be able to customize how we impact behavior change. Absolutely, we think that it's a huge ecosystem of grocery markets and a million other different places that can get involved.
All right, but thanks a lot. Thanks for this CES 2021 live interview from one side of the planet to the other. Thanks a lot.
Thank you, and have a great show.
And looking forward to this technology really making a difference and being available everywhere, and people who need it getting it.
Well, stay tuned because we're going to continuously publish all of our evidence on the impacts that we're having. So stay tuned and you'll be able to see all the results.